Ladies and gentlemen, I'm very pleased to welcome you to this Global Health Symposium on obesity, scientific lifestyle and policy approaches. I'm particularly grateful, really grateful, to the Minister of Health, Professor Ferruccio Fazio, for coming to Washington to participate in this event today. This clearly shows how important the Memorandum of Understanding that we signed last year is to him and how close our bilateral relationships are. Today more than ever. Minister Fazio and Secretary Sebelius recalled just this during their meeting yesterday. The Memorandum of Understanding is being implemented very effectively, and this is evident in the success of the joint research initiatives in all fields, from cancer to reconstructive medicine, biosecurity and biosafety. Minister Fazio has recently promoted the national guidelines to guide clinical and technological appropriateness in the management of obesity and diabetes. And in fact, there are many events, almost daily events, the Ministry of Health is undertaking in Rome in cooperation with regional, local authorities, with the Ministry of Education, with school, high school, and so on. So, as you can see, Italy and the United States are very well synchronized, also in the practical events, which are organized in our national system. And in fact, the Italian system works consistently both at the domestic and at an international level. I would like to extend a very special welcome to Dr. William Glazier, Science and Technology Advisor to the Secretary of State, and to Dr. Thomas Frieden, Director of the Centers for Disease Control and Prevention. My warm gratitude also goes to Dr. Andrews, Deputy Director of Pan American Health Organization. Let me acknowledge and sincerely thank all the distinguished symposium speakers and participants, as well as its generous partners and sponsors. And among them, I would like, above all, to mention the Center for the Study of the Presidency and Congress, chaired by Rear Admiral Dr. Susan Blumenthal. It's only thanks to her dedication, to her remarkable experience and support, and that has been, as always, invaluable that this symposium is taking place. Dr. Blumenthal is known for her unwavering commitment to all global health issues, to include HIV, AIDS, and other topics that impact public health and society, among which nutrition. Intergovernmental collaboration on public health is moving higher up at international agendas. A great many Italian scientists work in national institutes of health laboratories, as well as in universities and research centers throughout the United States. Our topic today is most timely. Both national and international data point toward obesity and related health problems, and they occupy an increasingly prominent place in our national policies. Therefore, we must focus on its prevention and cure. According to the World Health Organization, over the last 30 years, this phenomenon has more than doubled worldwide. And today, an estimated 1.5 billion adults are overweight, and over 500 million of them are obese. 42 million children under the age of 5 are overweight. Childhood obesity is therefore one of the most serious public health threats of the 21st century. And an alarming outbreak of this phenomenon is in Italy. And that has brought our country on a par with others on this aspect. This is largely due to a shift, a very evident shift, in nutritional habits away from a Mediterranean diet and to lower levels of physical activity. It is a trend that should be reversed. How? Precisely through increased exercise and right dietary choices. Improving nutritional habits is a societal, not only an individual goal. Therefore, it calls for a population-wide and cross-sector cultural approach. Science and research in the biology and the clinics of obesity are of the essence. Behavioral and social sciences are pivotal in putting research results into practices in terms of prevention and lifestyle improvement. The private sector should do more too. This pandemic can only be corrected through the joint action of governments and food and fitness industries. The whole panel today is in fact dedicated to this partnership. Promoting prevention is essential to keeping the obesity epidemic under control, and we must focus on good practice. Finally, I would like to underline how closely our topic today is related to the Universal Exposition that will be held in Milan in 2015. The exposition which is dedicated to feeding the planet energy for life. Expo 2015 will be a unique event displaying tradition, creativity and innovation, and focusing on the goal that everyone on the planet should have access to food that is healthy, safe and sufficient. Its themes include preventing the new epidemics of our time, including obesity, promoting research, technology and education. So far, over 50 countries have already confirmed their participation in the Expo, and it is my firm hope, the firm hope of the Italian government, as I mentioned before, that the private sector could play a strong part in Expo Milan 2015 with the support of the US government. The central themes of the Expo are of outstanding global importance, especially in light of the current debate on the world population reaching 7 billion people in the next few days, while in the 50s, as we know, the world population was half of that. The availability, access and use of natural resources and the environmental impact of technologies to improve productivity become therefore increasingly important. Several important players are here today. We look forward to hear their suggestions and recommendations. And on this note, I would like to thank the Meridian International Center, the Barilla Center for Food and Nutrition, Ferrero, Tecnogym, the Wellness Foundation for their support. Global health is the object of increasing attention in Italy. Just a couple of days ago, I received a letter from the Dean of Rome's Tor Vergata University inviting us to a possible health forum which could be organized there next year. It is wonderful to see that global health is living up to its name and that it is becoming a worldwide interest always more in our countries. I'm now deeply honored to yield the floor to Minister Ferruccio Fazio, Professor of Diagnostic Imaging and Radiation Oncology at the University of Milano Bicocca. Professor Fazio is not only a member of the Italian government and a reformer of the Italian National Health Service, he is especially a well-known scientist and leader in Italian and European medical environment, and is a strong advocate of the US-Italian collaboration. The Minister has given a new shape to the Italian research program and is a leading voice to Italian scientists abroad, especially in the United States. Thank you very much, Mr. Fazio.